Yeah, so basically, as you may be aware, Liberia and many other countries as consider WASH as a constitutional right for citizens, and so because of that, everyone everywhere, according to Sustainable Development Goals 6, we should be able to have access. But then with the recognition of WASH in our constitutions, there's still many persons that lack basic access to services, and communities are not given the opportunity to participate into budget processes. Another issue has to do with local government and civil society are not able to break the barriers of accountabilities. So making the platforms of WASH accountabilities is still a major challenge. And WASH is actually not a priority issue in national policy, most especially for our country. And because of that, you won't find budgeting at local level considering WASH. And the root causes of some of the challenges range from political prioritization, inequalities in policies and plans and action. Next slide. Yeah, so as I mentioned earlier, Jonathan and I, we were opportune to participate. We completed and were awarded a project which is intended to understand the accountability mechanism within the water supply system of the Liberia Water and Sewer Corporation. And the project focused on the Liberia Municipal Water Projects. It is a project sponsored by the USAID, and this project was implemented by the Liberia Water and Sewer Corporation. It is an autonomous agency of government responsible to provide water services in urban cities. Next. So the goal of this project is to examine the accountability cycle of LWSC, their water supply system, and also the user perception with respect to donor targets. So we intend at the end of the program to ensure that stakeholders become more responsive to the needs of water user communities and the most marginalized or vulnerable society. And it will also provide evidence for what works, how and when, and will complement and strengthen ongoing initiative focused on the legal, the regulatory, the social and political accountability aimed at improving water security. It will also produce and share research, knowledge, and evidence to strengthen accountability for water supply, sanitation and hygiene services, water resource management, and good water sector governance. It is all aimed to accelerate and ensure equitable delivery of the SDG 6 sustainable water and sanitation for all by 2030. Next. So what do we expect to achieve from this research? We intend to develop a CSO advocacy tool, civil society advocacy tool, for increased allocation and appropriate use of resources allotted to WASH services through WASH accountability forums. At the end, we also want to share research funding with stakeholders for making informed WASH financing and accountability decision. We want to increase citizens' demand for accountability in WASH service provision. Next, please. So there are key questions that we designed for our donor partners, and the key research question number one has to do with the accountability system put in place for water supply services, working with the partners, let's say the LWSC. So we needed to know, how do you evaluate your client reports? How the donor provide in line with their requirements, accountability requirements, procedure. How is the implementing partners working to ensure that we are keen to hear from the donor the challenges encountered with respect to accountability, working with the LWSC. We also ascertain the areas of accountability that they do not notice lacking while working with their implementing partners. So there are some evaluations that were done by the project, by the donor. So we wanted to understand from the evaluation of the donor program, at what level the donor attach importance in terms of the beneficiary feedback. Next slide. All right, so another key areas that we look at doing the research is to what extent are citizens able to address availability and complaints about the water services that they receive at the community level. So we were able to gather more information about that. The donor own experience working with a citizen complaint. What are the channels for the donor to receive citizen complaint? What are the systems put in place by the donor to address citizen complaint? So these are specific questions that we were able to ask our donor, the USAID and the African Development Bank. Next slide. All right, so we use both qualitative and quantitative approaches during this project. So the first phase of the project is what we have completed, and that has to do with the key informal interview, test review with the donors and key stakeholders. The second phase of the project is currently ongoing. That is targeting at community level, where we will have few focal group discussions, data collections, and then ensure that the perception of citizens with respect to donor sponsor projects are clearly identified. Next. So from our engagement with the donor, we have been able to realize key things that we take note of, and as we go at the climax of the project, we will get more in-depth information. But the first thing that we realized was the responsiveness of donor to civil society core. So when we started, we involved both the government agency that's responsible, which is the LWSC, and the donor partners. So the donor partners are able to respond to all quickly as compared to the government agency. So we thought that was something very key as civil society seek information, getting the necessary response, is very key. So donor working with the private, we noticed that the donor, the USAID to be specific, designed a model to work with private sector and allow government to monitor. From the past, there are past experiences where the government is not accountable to donor. So it's a little bit difficult for donor to demand accountability while working with government because of some bureaucracy and so forth. But they have decided to work with private sector that is easier to demand accountability and then provide the government the opportunity to conduct the monitoring and the capacity building role. Another key things we realize is that because of that, donor working with the private sector, it helps to strengthen the issue of accountability and maintenance of services at local level. The donor and the private sector implemented the project on a system where a community-based steering committee, we call it a local steering committee, was established at a community level to ensure sustainability of WASH services. So this committee make the key decision with respect to the project. So location of site, services provided, local community contributions, fees, and use of fees. So these key decisions are made by the local steering committee. Quarterly visit was conducted by USAID, and that also helped to improve the relationship between the beneficiaries of the project and the donor. And then we noticed with our engagement with the donor that there was low population because we are into 2 counties. Where we were able to absorb with the donor is the Rabosport. Rabosport is a city that is situated between the lagoon and the sea. So because of that, the population, the water level is a little problem. But then we realized that because of the population, the private sector are not able to generate more funds to sustain the WASH programs and services at the county level. So that was something that we catch up. Next slide. Okay. So we also discovered during our research that there are 2 donors that supported the program. So one is the African Development Bank, and their model is working directly with the government. So from our observations so far, we have noted that because of the African Development Bank working directly with the government, the issue of accountability and sustainability of services are very poor. So to be specific, there were a specific project that civil society were able to discover during this year World Toilet Day program. There are 11 latrines, public latrines that were constructed in one of the communities in the capital city. Those latrines were constructed directly by the government with funding from the African Development Bank. And because of that, since 2016, those facilities were constructed. They are now been able to open to the public. They have been damaged. Majority of those services have been damaged. So we noticed that the model of the USAID by working with private sector and providing opportunity for the government to play the monitoring role, that model is working effectively as compared to the African Development Bank model by giving the partners the government direct funding. Next. Good. So as you can see, these are the structures. So you see that those services are well constructed. Enough funds were spent to those to build those structure, but then they were not being able to. Citizens were not able to access them. So civil society, through our assessment, were able to mobilize the community. Right now, as I speak to you, there are communication. The citizens were able to work with civil society to do an official complaint to the national legislature. There's a WASH legislative caucus that civil society were able to advocate for. And so there are currently actions that have been taken by the WASH caucus. So that's one of the means that we are using as civil society to strengthen accountability with respect to WASH services. So in a few days, there is a forum that has been called by the WASH Legislative Caucus, calling on the government agency responsible and the donor partners to provide reason why those services were constructed and then as not in use. And if those reasons are not sufficient enough, there will be further actions taken by the national legislature. So we're trying to balance the advocacy where we gather the facts, and then we have a specific group of lawmakers that will help us to ensure that sustainability of those services and ensure accountability in public services provision are key issues that should be considered. So we want to say thanks to our partners as we continue the project. At the final stage of the project, we'll come up with a full report. But where we are now, we have just done with the first phase, and we just thought to share some of the lessons learned so far. Thank you.